The California Integrative Heart Disease Prevention Project by Mark Dean Elliott. Our mission and vision. The California Integrative Heart Disease Prevention Project seeks to identify, analyze, and disseminate conventional and non-conventional heart disease prevention practices in an effort to establish an integrative approach that is both effective and comprehensive. Our vision is to create a comprehensive heart disease prevention strategy that combines the best evidence-based treatments and procedures, to create a treatment paradigm that views heart disease prevention using a whole person or holistic approach, to reduce the incidence and prevalence of heart disease among Californians, and to lead the way in establishing the validity of complementary and alternative approaches towards disease prevention. The goal of the California Integrative Heart Disease Prevention Project is to identify and examine complementary and alternative approaches to heart disease prevention and treatment in an effort to create a comprehensive treatment model that is effective in reducing the burden of heart disease in the state. Our objectives: in year one, identify complementary and alternative prevention and treatment practices that will bolster current clinical protocols in the treatment and prevention of heart disease. To assist in the development of a comprehensive public health strategy utilizing the most effective medical techniques, both conventional and chem-based, as demonstrated through systematic analysis of relevant research data. To implement a comprehensive integrative prevention and treatment strategy by the end of year 5. And finally, to reduce the incidence of heart disease from 3.2% of the population to 2.9% of the population, equal to the state with the lowest incidence of heart disease within 10 years. Various stakeholders may be asking, why heart disease? Well, heart disease is the #1 cause of death in the United States. In 2014, nearly 27 million American adults were diagnosed with the disease. This resulted in 614,348 deaths nationwide. In 2011, the national costs associated with heart disease and stroke was estimated to be in excess of $315 billion annually. Heart disease is also the #1 cause of death in the state of California. In 2013, the disease contributed to more than 60,000 deaths in the state. This is an increase over the number of deaths in 2004, which equaled 52,000. The estimated annual cost associated with treating heart disease in California was $37 billion in 2010, constituting 16% of all healthcare spending in the state. And finally, both the human costs and the economic costs of heart disease may be avoidable through effective prevention strategies. The term cardiovascular disease, also known as heart disease, refers to a number of conditions that result in damage to the heart and blood vessels caused by atherosclerosis, or a buildup of fatty plaques within the arteries. This condition is largely caused by correctable problems. Some of the common causes of atherosclerosis include poor dietary habits, obesity, drug and alcohol use, and a sedentary lifestyle. The holistic perspective that is inherent to many complementary and alternative medical approaches may illuminate additional factors that contribute to the incidence and prevalence of heart disease, addressing the mental, spiritual, and emotional contributors to the disease. Heart disease may impact individuals in the public in a number of different ways. Some of the social and personal impacts of the disease include increased risk of heart attack, arrhythmia, heart damage due to attack and/or a reduction in oxygen supply, the possibility of sudden death, an increase in the need for long-term treatment, cognitive and emotional distress caused by the risks associated with the disease, an increased reliance on support resources including family members, caretakers, and medical professionals, and a reduced capacity to perform daily functions, such as work and recreational activities. Conventional approaches to the treatment of heart disease focus on several priorities. #1, the control of blood pressure. It's believed that a 12 to 13 point reduction in systolic blood pressure may reduce total deaths by up to 25%. #2, the control of high cholesterol. Coronary heart disease incidence may be reduced by up to 30% through a 10% decrease in total cholesterol. Number 3, educating the public regarding the signs and symptoms. Number 4, improving the quality of care with a focus on prevention. And finally, to eliminate ethnic, cultural, and social disparities in the prevalence and incidence of heart disease among the U.S. population. According to a 2013 article published by Harvard Medical School, nearly 200,000 annual deaths could be avoided through proper treatment and prevention. In addition, emerging research exploring complementary and alternative approaches towards the prevention and treatment of heart disease may provide a number of interventions that exist outside of the conventional medical paradigm. These practices embody a holistic philosophy that views human health from a whole person perspective, and may provide solutions to addressing the physical, mental, and spiritual factors that influence individual behaviors and the prevalence of heart disease. Although clinical research is ongoing, the following slide provides a demonstration of how various CAM techniques can be applied towards addressing the specific risk factors associated with heart disease. For instance, physical activity may be addressed through practices such as Tai Chi, yoga, and various mind-body techniques. Alcohol, tobacco, and drug use may be addressed through meditation, acupuncture, and mind-body techniques. Nutrition and dietary factors may be addressed through Chinese herbal medicine, Chinese dietary therapy, and Ayurvedic dietary therapy. It is clear that the current clinical techniques to prevent and treat heart disease have failed to reduce the burden that it poses on the health of the American public. The identification and implementation of CAM approaches to preventing and treating heart disease poses the potential to not only address heart disease directly, but may also provide an avenue towards preventing a number of chronic diseases that unnecessarily burdens the public, healthcare providers, and the national economy. The following slide provides a brief preliminary budget summary for year 1 of the program. A more detailed budget summary can be provided upon request. We can see at the top of the table that personnel for the program, including the program coordinator, the lead research analyst, the assistant research analyst, the quality control manager, and the public education manager, will cost approximately $142,500. Travel to various locations throughout California, including car rental and overnight accommodations, will cost approximately $2,143. Office supplies will cost approximately $6,800. And miscellaneous expenses, including office rental and reproduction costs for educational materials, will cost approximately $181,628. The total annual projected cost of the program is approximately $333,071. In order to acquire the funding necessary to carry out the operations of our project, our team has researched the various sources of funding for public health programs. Up to 74% of all state funding is provided through federal contributions distributed through the Department of Agriculture, the Centers for Disease Control and Prevention, the Health Resources and Services Administration, the Environmental Protection Agency, the Food and Drug Administration, and the Department of Homeland Security. Private organizations are another primary funder of public health projects. Prominent private organizations that regularly fund public health projects are the Robert Woods Johnson Foundation and private investors such as yourselves. The distribution of these funds is largely dependent on the satisfaction of a specific criteria of eligibility, something that this project is determined to demonstrate to its stakeholders. In closing, it is important to remember some of the facts that make the California Integrative Heart Disease Prevention Project such an important public health endeavor. Currently, the leading cause of death nationally is heart disease. Both national and state expenditures in the treatment and management of heart disease can be mitigated through effective prevention strategies. Conventional treatment and prevention strategies may lack the scope that is necessary to effectively reduce the individual, social, and economic burden of heart disease. Complementary and alternative approaches to heart disease management may offer holistic treatment and prevention options that may increase the effectiveness of conventional strategies. the reduction in the incidence of heart disease and the effective management of symptoms are a public health priority. It is clear that more effective prevention and treatment strategies need to be employed in order to reverse the trajectory of the nation's #1 cause of death. CAN-based therapies not only present new and novel approaches for treating heart disease, but they may also address other preventable diseases through the promotion of a holistic view of human health. It is the hope of the California Integrative Heart Disease Prevention Project that you, the stakeholders, will join us in the pursuit of establishing a more effective, integrative treatment paradigm. Thank you.